And okay, can you guys see the PowerPoint?
Yeah, I can see it.
Yes.
I don't know why it's small. Let's see if I can make it bigger. All right, that'll work for now. Okay, so we are going to talk about pharmacology. It's the science or branch of medicine that includes the research, development, and manufacture of drugs. A drug is a substance that can be taken for the prevention, diagnosis, and treatment of disease. Drugs are derived from many sources. Organic drugs derived from living organisms such as animals, and your inorganic drugs are synthesized in the laboratory or extracted from inorganic compounds. Most drugs today are derived from chemical sources. Drugs can be identified three ways. Chemical name, that's the anatomic molecular structure of the drug. Generic, the shorthand version of the drug's chemical name, structure, or formula, a name that any business firm may use, or a brand name or trade name controlled by a pharmaceutical company as a registered trademark. Drugs are classified in two categories according to the way an individual can purchase them. Patent medicines are drugs that can be obtained without a prescription. Those are referred to as the over-the-counter drugs. Prescription drugs are licensed medicines that are regulated by legislation and require prescription before they can be obtained from a pharmacist. And those are referred to as ethical drugs. Now, there's a DEA scheduled drugs, and they go from 1 through 5. So 1, no current accepted medical usefulness and a high potential for abuse. 2, high potential for abuse but accepted medical usefulness as well. 3, less abuse potential and accepted medical uses. 4, low abuse potential and accepted medical uses. And 5 is not required to be prescribed. Now, that's really more for the doctor, the dentist. Prescriptions, a written order provided by a physician or dentist for the preparation and administration of a medicine by the pharmacist. Only a professional who is legally authorized to prescribe medications may write a prescription. A professional who's authorized to prescribe medication is issued a Federal Drug Enforcement Agency, DEA, identification number. So when you guys get into the office, don't fool yourself. The people that are going to be writing the prescriptions mostly are you. The doctor will dictate it to you. So he'll say, go and get me a prescription for antibiotics or pain pill. And you'll need to say, what kind, doc? And he might say penicillin or amoxicillin. Just listen is what you need to do. Now, the great thing is, back in my days, we had to really write them out. Nowadays, most doctors buy the stamp. So all you have to do is listen to what the doctor is telling you. You get the stamp for, if he said penicillin, you get the prescription pad, you stamp it, and then you fill out the patient's name and all the information on the top, and the doctor signs. Now, once you do this quite often, you will know his DEA number or her DEA number, and you'll add that on the prescription because the doctors are moving so quickly from patient to patient. All they want to do is sign, and you are the one who makes a copy to make sure that you have it in the patient's chart. You always have to make that copy. Don't and then you give them the prescription. Don't forget, because if the pharmacy calls, you need to go back to that prescription that you gave them and look at it and see what you did wrong. Now, prescription terminology. There's parts in a prescription. There's the superscription, the patient name and address, the date, and the symbol RX. So those are the parts that you're going to fill out. Make sure you don't abbreviate, okay? So the patient's name is the patient's name, the date. If it's 1 month, like let's say January, instead of just writing a 1, you have to write 01 or 01. Lots of prescriptions, though, they want you to actually write the abbreviation for January, JAN, like that. Now for the date, always two. So two numbers for the month, two numbers for the date, and four numbers for the year. The inscription is the name and quantity of the drug. The subscription is the directions for mixing the medication, and the signature instructions for the patient on how to take the medicine, when to take it, and how much to take it. Again, documentation of each drug prescribed must be recorded in the patient record. The dentist will write the prescription in duplicate so that a copy can be retained for future reference. So that was back in the days. We no longer have the duplications anymore. So that's why I was telling you guys, make sure you either make a copy, you scan it into their chart, one or the other. It all depends on how your office that you go to has it. Are they still doing paper charts? Then you have to make a copy. If they're doing charts in the computer, then you scan it into their file. And you got to make sure you scan it into the right file also. This is what a prescription looks like. So everything that I mentioned, yes, if you have prescriptions on the computer, the great thing is too that you can put in pretty much it'll print out their name and their address and their telephone number and even their date of birth. But this part, you will tell the computer where the RX here, the inscription, you will put, you know, whether it's going to be, like I mentioned, antibiotics or pain pills. But I will say this. A lot of doctors, even if they're computerized and they have all the patients on the computer, they really don't do too many prescriptions by computer. Anybody know the reason why that would be? If we could just print these through the computer, anybody know why?
No.
Say I could print this through the computer 5 times. Does that become a problem? Yes. No, maybe so.
I think yes.
Yes, absolutely. And you know why? Because here's the thing. This is why I'm telling you, a lot of doctors, though they have the capacity to print it from a computer, they prefer not to. Because say you print for just like this one, Mary Smith, and you can print it over again and over again. So now you gave a prescription to Mary Smith and you took one for yourself, and now you're abusing the drug. You know, so a lot of doctors don't want prescriptions to be abused. So even if there's a prescription pad in the office and you have to write it on a prescription pad and give it to the doctor to sign it, he's basically looking to see what he's signing. If he sees Mary Smith 5 times, he's going to question you like, how come I signed a prescription pad for Mary Smith 5 times? And then he's going to start questioning you like, no, why are you writing prescriptions without my authority? Or why are you repeating this prescription? So Florida is one of the capital towns of, I should say, states of pill popping cities. I'm pretty sure that there's other states they have cut down, and that's because of illegal use of prescription writing, whether by the assistant or the dentist. Okay. By the way, if you are caught writing prescription pads without the authority of the dentist, you can be jailed or fined. Okay, so be real careful. Now, in your Kindle, I don't know if it's on the table 30.1. If you are on the old, the new edition, if you're on chapter edition 13, it might be the same table, but you will have this in there. It's the abbreviation. When you get a chance, please make sure that you study the abbreviations and the meaning, because on the prescription, the doctor will tell you make sure that they take it before meals. So you would have to make sure that it says AC, or just take it in the morning. Of course, we know AM. You know, things like that. Every is a Q. Once a day, QD. Notice that there's little points, little dots in it too. So again, you have to kind of know, these are the most common. So if you just study these and know them, so that way you know. Also, when you give a prescription to a patient, you have to explain to them. If you see AC on it, you got to be like, oh, what does AC mean? And you have to let the patient know before meals, okay? Now, telephone guidelines. Narcotics cannot be ordered without a written prescription. It is illegal for a dental assistant to call in a prescription. We can, but we cannot do narcotics. We can do antibiotics. So if the doctor asks you to call in a prescription, it could be for any type of antibiotics. Narcotics is a no. When a pharmacist calls, notify the dentist immediately. Do not try and relay information between them. Well, that doesn't happen all the time. Sometimes the pharmacy calls and you have to find out why they're calling. So if the dentist is in between a patient or with a patient, you can let them know and then go to the pharmacist and let them know what the doctor said. And the pharmacist does understand. Now, if it's really complicated, then they will speak to the dentist or the dentist will have to call the pharmacist back. Again, if the dentist is unable to come to the telephone, take all the information, telephone number, so the dentist can return the call, and never attempt to evaluate a patient's reaction to a drug. That's not our responsibility. So again, if you get the pharmacist on the phone, take notes of what exactly he's saying. You know, so then that way you relay the message correctly to the dentist. Don't try to remember it, because sometimes as you're going to relay the message to the dentist, somebody stops you in the hallway or something, and now you totally forgot what you had to say. Drug reference materials. So there will be a printed drug reference. It's called the physician drug reference, PDR, or the Mosby's dental drug reference. Now, either one, usually the doctor, the dentist has this drug reference in his office. Just kind of find out where he keeps it, because a lot of times he'll ask you to go and get it for him, because patients come with so many complications that even the dentist once in a while has to check in the PDR or the Mosby. I'll tell you right now, the PDR is actually the most common in a dental office. So he'll say, can you go and grab me the PDR? And he'll check it, because a lot of the medications that the patients are using will contraindicate what he's going to give. So they don't go together. So he'll ask you for it. Package inserts. Now, this part here, most people that go and get the prescription, there will be these package inserts, and usually the pharmacist or the pharmacist assistant will be the ones to explain to the patient how to take the drug, okay, and how it will affect it. I can tell you right now, most people don't even read those information sheets. They just read the little bottle. If it says take one a day, that's it. They don't look to see how the drug will affect the body or what condition the drug is used for, any adverse effects, any adverse long-term effects, any special precautions, any contraindications, or a lot of times they don't even take the dosage and the route for the drug correctly. Now, a dose is the amount of a drug that a patient takes. Specific factors in determining the dosage are the age of the patient, with it affecting the newborn and age the most, okay? Weight of the patient, the time of day the drug is going to be taken, and patient tolerance to the drug. Drugs come in many different forms. It can come in pills, capsules, liquids, drops, ointments, sprays, gases, and lotions. Most of the time, though, the dentist usually prescribes pills or capsules. On occasion, maybe some liquids. The way a drug is administered determines how quickly it takes effect. Local action drug is usually applied directly to the site of use, and systemic action drug can affect the whole body by way of the circulatory system. So here's some pictures of how we give out drugs the oral route way. By the way,
Miss Paris,
yes,
I can't see the pictures.
you can't see the pictures?
Yeah.
What about now?
Mm, no, not yet.
Okay, hold on a second. Let me see what's going on.
Oh, no, okay.
I guess when I put it on the big thing, let me see. Did I have any other pictures? Yes. Did you see this picture?
No.
Okay. So in your Kindle, when you get a chance, look at this picture here, the example of a prescription pad, okay? How it looks, because that's what I was talking about. And then in this picture here, and just for future reference, if you don't see the picture, let me know right away and I'll see what's wrong with the PowerPoint, okay?
Okay.
And then this is the one that I said, study the abbreviations. This should be in your Kindle. And then I was on this picture here. Okay, so this picture here, as I was mentioning, the doctor gives mostly pills, tablets, and mostly liquids in the dentist's office. This next picture here, topical, we usually do that. We usually put the topical on the patient's in the patient's mouth. It's like a little gel, and it comes in a little bottle. And you guys will do this check off when you come to lab. Basically, we put this in the site where they're going to get anesthetic. We don't use the word injection or needle. We don't want to scare the patient. So we put this on the site, and then the doctor will come and give an injection. We usually leave this on for a minute, and then we take it out and the doctor's ready. And then this is a different kind. We don't really do this in the dentist's office, which is the patches. And then there's more here, inhalation. So that's really for people that have breathing problems. Sublingual, that's for people that have heart problems. Most of the time, they put a little pill under their tongue. And then injection route, that is what the doctor does, okay? The dentist. We never, ever give any type of injection. There's different stages of drug action in the body. Absorption, drug is absorbed from the site of entry. Distribution, the chemical compound of a drug attaches to proteins within the blood and it is circulated through the body to be released and take effect where it was meant to act. Metabolism, once the chemical compound is released, the drug becomes metabolized and is then excreted through the liver or kidneys. And excretion, the drug leaves the body by way of kidneys, liver, saliva, breast milk, and sweat. The most commonly prescribed drugs in dentistry, these are either to be taken by the patient prior to a clinical procedure or after, or taken because of a condition that has affected the oral cavity. It can be any of these analgesics, antibiotics, antifungal, antiviral, and anti-anxiety, and we'll talk about each one of them. So your analgesics are prescribed for the relief of acute pain, post-operative pain, and or chronic pain. This type of drug lessens the sensory function of the brain by blocking pain receptors. Excuse me. The non-opiate group of analgesics includes the non-steroidal anti-inflammatory drugs such as your Tylenols, your Advils, or your Motrins. So those are your antihistamines, your ibuprofens, and your aspirins. This group is indicated for mild to moderate pain. By the way, most doctors now for pain are prescribing either one of these, Tylenol, Advil, or Motrin. As I mentioned to you earlier in our lecture that Florida has become a big pain prescription state. So the dentist got fined for giving out so many prescriptions. So earlier, I believe it was last year, the dentists were told by the ADA that as far as pain, they needed to give Tylenol, Advil, or Motrin, and patients were pissed off when we were telling them that we were no longer giving them pain pills. They had to start with Tylenol or Advil or Motrin. Believe it or not, 3 of either one of those is the same as one pain pill that we give. It's the mind thing. So patients think, oh, Tylenols or Advils or Motrins don't work. They actually do. The problem is that patients in their mind already have it set that it's not going to do anything. I actually need a prescription. So if they are told to take Tylenol, Advil, or Motrin, that's what they need to take as far as a pain pill. Now, the only time most pain prescriptions are given now is for oral surgery or any type of mouth surgery. And that's when they might even give them codeine. But again, it all depends on the doctor. Antibiotics, so they can be classified as bactericidal or bacteriostatic. So they give penicillin to kill an infecting organism, and your bacteriostatic is your tetracycline, your erythromycin. They inhibited the production of bacteria by interfering with their metabolic process. So again, all depends on the doctor. So that's why you have to listen when he tells you to get the prescription. If he says penicillin, get penicillin. If he says tetracycline or erythromycin or amoxicillin or whatever it may be, any of these down here are what you probably will hear. I can tell you right now, penicillin, erythromycin, and chlorhexidine are the most common antibiotics that are given in the office. Chlorhexidine is given a lot for people that have periodontal disease. That's gum disease. And it usually comes in a mouth rinse. Okay. So again, it can come in different forms, pills, liquids, gels. So again, whatever the doctor decides to prescribe for them. Now, there's something called antibiotic prophylaxis. And what that is an antibiotic that's given to a patient to prevent bacterial colonization. So most patients with certain heart conditions are usually prescribed an antibiotic to be taken prior to their dental treatment. But back in 2008, the American Heart Association, they released a new recommendation that most patients with cardiac conditions no longer need short-term antibiotics as a preventative measure before their dental treatment. Again, that is all on the doctor and even the patients. Sometimes the patients, they've had so many problems with their heart that they don't even want to risk it, and they will ask for antibiotics prior to their dentist appointment. So that way they can take it, have the antibiotics in their system, so when they have the dental procedure done, they don't get an infection. Because if you guys don't know this, the first place the infection will travel is wherever the patient has complications. So if a patient has complications with their heart and they develop an infection in their mouth, it travels to their hearts and complicates matters. If a person has an infection in their leg, then it travels to their leg. So again, it all depends on where the person has had problems. So that's why we usually give antibiotics prior. Now, can it be done all the time? No, because if a patient has an emergency, how are we going to give them antibiotics firsthand? So it all depends on what the situation is. Now, again, as I mentioned, 2008 guidelines. So anybody that has artificial heart valves, any history of infective endocarditis, that's heart again, serious congenital heart conditions, heart transplant. So for sure, these people need what we call preventative antibiotics. And they usually have to take antibiotics about an hour before their appointment. And if they don't take it, their appointment usually has to be rescheduled. The doctor doesn't want to take the chance of them having a heart failure in the chair. Okay, so again, and of course, all medicine is based on age and weight. And you should have this diagram in your Kindle. But again, I wouldn't get too crazy in studying this one because this is more for the doctor to know. Okay, the dentist. Now, there's some antifungal agents, and these help fight fungus. Believe it or not, patients get fungus in their mouth. Most patients that get fungus in the mouth is called candiditis or candida. And a lot of the patients that get fungus in their mouth are usually the ones that are wearing poorly fitting prostheses. Patients with xerostomia, that's a dry mouth, or even some patients who start taking antibiotics. So there is a drug that's out there. It's called nystatin, and it's like a little pill, and the patient has to basically kind of like suck on it, so that way the fungus in their mouth can go away. And depending on how many days, if the doctor tells them 7 to 10 days, they have to do it every day for 7 to 10 days. Now, viral infections such as hepatitis, hand and foot and mouth disease, herpes, any kind of herpes, herpes zoster, HIV can all affect the oral cavity. But with most viral infections, some type of lesion commonly appears in the mouth. We do have some antiviral agents that we can prescribe for them in capsule, tablet, liquid, and even ointment forms. And the most common, you will hear the word Zovirax. Okay. Now, there are some anti-anxiety agents that we can give to the patients. Those are so they can have what we call a pain-free dentistry. So for patients who have hesitated going to the dentist because of their fear of pain, can now receive these type of drugs or even sedation to help manage their pain and anxiety during dental appointments. So what would happen is they would come in for their first appointment, and then if they start, oh, I'm nervous, I can't come back, I'm sweating, I'm this, I'm that, the patient will the doctor will prescribe to them an anti-anxiety agent. Now, with that said, usually any patients that get that drug, they need to come with somebody because usually that drug makes them sleepy. And of course, we can't have them driving to the office and driving home, so that doesn't cause any accidents. So someone would have to come with them or drop them off and then come and pick them up. And then usually with those type of people too, the anti-anxiety, the people that are very anxious, we try to do as much work as possible so we're not medicating them so many times. Now, the drugs commonly prescribed in medicine, many patients who will be seen in the dental office will be taking prescription and over-the-counter drugs prescribed by their personal doctor because of a medical disease. So again, this is where I was telling you guys that because so many patients are taking so much medicine, the doctor wants to make sure that a lot of the medicines don't contraindicate with what he's giving. So this is where he'll ask you for the PDR. Can you get me the PDR? Go and get him the book. The book is really big and heavy. It is important to have background knowledge of the drugs that your patients are taking and how they affect your patient's total health, as well as how they could interfere with their dental care. I have to tell you guys this too. When you bring a patient to the office, like to the operatory, and you're questioning them about their medical history, sometimes they don't write it in their medical history, but they might tell you, I had a shot of tequila before I came today. I smoked some weed before I came in. Um, I took some medicine that my sister had in the medicine cabinet, but I felt like I needed to take it. You need to let the doctor know about all this because they might not tell the doctor, but they feel like they can tell you. So make a note of it on a pad. And when the doctor comes in, slip him the note and let him read the note so he knows what's going on. If you do not tell the doctor that they told you that they drank before they came in or they smoke weed or whatever, you're going to get in big trouble because that's information that you must divulge to the dentist, even though they did not put it on their medical history. So be listening and paying close attention to what they tell you, and make sure you let the doctor know if it's not written on the medical history. Cardiovascular drugs, there's a series of drug classification that can be prescribed for patients with cardiovascular disorders. Statins, that is to help lower the cholesterol. Diuretics, help reduce fluid retention, anticoagulants, prevent blood clotting. With that, I'm going to tell you, by the way, looking at the medical history, start really noticing medicines that go with things that patient marks. So if they wrote cholesterol, kind of look at the medicine so you have an idea what goes with what. I stopped at prevent blood clotting because a lot of times doctors will tell those type of patients that they need to stop that medicine because they need them to clot. So, for example, if a patient comes in and wants to get an extraction and the doctor notices that he's taking medicine to not have him get a blood clot, the doctor is going to ask him to, number one, ask his medical doctor if he can stop that medicine, or number two, that he won't be able to see him because if he extracts a tooth, he needs the tooth to bleed in order to close the hole. So again, you might hear, and this is why don't tune out the conversation that's going on in the operatory. You need to hear what's being said so you can understand. And then once you hear it, you'll understand what goes with what and understand medical histories and medicine a little bit more. Now, antiplatelet drugs also work to keep blood clots from forming. Beta blockers control blood pressure. Slow, fast arrhythmias reduce angina, chest pain. So again, if somebody has a blood pressure problem, we have to monitor those people because when we give, when the doctor gives any type of local anesthetic, that might raise or lower their blood pressure. So we have to kind of monitor that. Digitalis stimulates the heart to beat more forcefully. Vasodilators reduce the work of the heart. Respiratory drugs. So a significant number of individuals have respiratory disorders that require the use of medications. Agents from two drug classifications can be prescribed: inhibitors or anti-inflammatory drugs or bronchodilators. So in other words, if a patient comes with breathing problems, respiratory problems, if they're on an oxygen tank, more than likely the doctor will refer them to somebody that can better help them, like a specialist. If they have asthma, they need to have their pump, okay? And if they don't, the doctor might want their appointment rescheduled because we need these people to breathe as we're working on them. And if they don't have the required medicine or pump with them, then we can reschedule their appointment. Gastrointestinal drugs. Specific diseases that affect gastrointestinal tract include heartburn, acid reflux disease, peptic ulcer, diarrhea, Crohn's disease, and ulcerative colitis. Now, a lot of these drugs are over the counter, and they would be prescribed for a patient with one of the following, as I mentioned above, okay? So if they're taking those drugs, they have to just mark it on the medical history again so we know what they're taking. Neurologic drugs, those include diseases such as seizure disorders, Parkinson's disease, multiple sclerosis, and even Alzheimer's. Usually with the Alzheimer's, or actually any of these patients, they usually have a nurse come with them or a family member come with them because they need help, whether getting in our chair or even help. Like if it's an Alzheimer's, they're not going to be able to remember certain things. So they might have a family member or a nurse that will let you know what their medications are, what they're taking, what their medical history is. So again, please note that, look on their medical history. If they have any of these, they usually have somebody come with them, and they'll come into the operatory with them. And then sometimes they're given anticonvulsant drugs to control seizures, anti-myasthenic drugs for muscular weakness, anti-Parkinsonism drugs to help control tremors, and anti-spastic drugs for spasms. So again, these people, they're not easy to work with because think about it. If they're like shaking, if their hand is shaking or they have muscular weakness and they have tremors or spasms, if they're moving and the doctor has a handpiece in their hand, it's very hard to work on somebody that is constantly moving. So he also might send these to a specialist that can put them out, to control their seizures or spasm or things like that. So again, It all depends on the dentist. Psychoactive drugs, those include antidepressants and anxiety, antipsychotic and anti-manic drugs, as well as sedatives such as sleeping pills and drugs given for attention deficit or hyperactivity disorders. And again, they can include anti-anxiety drugs, antidepressant, anti-manic bipolar disorder drugs, or antipsychotic drugs. Those people you're going to have to watch because their mood swings are all over the place. One day they'll come into the office and they love you, and the next time they come into the office, they hate you. You know, that's not really a problem. The problem is the people that come in that are very aggressive. Those are the ones that the doctor will probably say that they can't see. Okay, so again, looking on the medical history, he'll see if they mark anxiety and if they're taking any medicine, and then he'll decide whether he wants to see them or not. A dentist has the right to refuse anyone or to refer them to somebody that can better take care of them. Endocrine endocrine hormonal drugs correct the overproduction or underproduction of the body's natural hormones, and specific drugs associated with diabetes or metformin and insulin. Estrogen and progesterone are used in birth control pills and are also prescribed to women for relief of symptoms of menopause. So again, patients, any drugs that they take should be written, and sometimes people forget to mark simple things as that too. Adverse drug effects, the body's negative reactions to a drug. Review the printed insert. I will let them know when I give a person a prescription. I tell them if when you pick up the prescription, please make sure you read the printed insert for any adverse effects, okay? And then drugs can possibly interfere with normal function and may even create a potentially life-threatening circumstance. By that, there's some drugs that make people sleepy. So say, for instance, truck drivers, we're real careful when we give them prescription medicine, and we tell them, be careful because this drug can make you sleepy. And I know you drive over the road, so you want to make sure that you only take when right before you go to bed, that type of thing. So people are told, whether they listen or not is on them. And also, again, reading the product insert. Now, common adverse effects of medications: hyperexcitability, insomnia, dizziness, drowsiness, central nervous system effects, changes in bleeding time, hypertension, hypotension and fainting, weight changes, appetite changes, edema, blurred vision, sexual dysfunction, sweating, opportunistic infections like your yeast or your fungal, or photosensitivity. Excuse me. Photosensitivity means that some drugs say when you take this medicine, stay out of the sun. It might give you brown spots or change the color of your skin. Edema, swelling. Let me see. And the rest you should kind of know a little bit about. Drug complications, allergic reaction. A drug triggers the immune response. Reactions can range from a common rash to life-threatening anaphylactic shock. So if you have a drug reaction, the first person that you need to call is the person that gave you the medicine. So the dentist, or if you can't get in touch with the dentist, the pharmacy. They will, they also sometimes can contact the dentist for you. And they can also let you know, take this, or of course, any medicine, you get some type of reaction, you stop the medicine right away. You don't keep on taking it. And you tell the patient the same thing. Drug toxicity, toxin-induced cell damage and cell death, and drug interaction when multiple drugs are introduced to the body system. So again, if patients lie to us and they're taking a whole bunch of drugs and we give them some and there's a drug interaction, they can't blame us because they kept information away from us. Drug tolerance, loss of effectiveness of a drug over time, and drug addiction, physical dependence on a drug. Now I'm going to go back to drug tolerance, and I will tell you this. a lot of patients are given antibiotics for 7 to 10 days. Within 3 days of taking it, they usually feel better. And what do? Instead of finishing it, like the bottle says, take up to 7 to 10 days, they say to themselves, I'm going to save this medicine just in case I have this problem the next time. Well, of course, you're going to have this problem the next time because you didn't take the medicine the way it was supposed to be taken. And usually what happens is when you don't take a certain medicine that was given to you, usually you become tolerant to that medicine, meaning that it will not work again if that same type of medicine is given to you because you didn't take it right the first time. So when we give antibiotics to patients, please let them know if the bottle says 7 days, please take all 7 days so the infection is clear. You might feel better, but you really need to take the medicine until the medicine is finished. That's just for antibiotics. For pain, they only take as needed. Does anybody have any questions?